Dr. Eckstein. Dr. Nichols, can you please elaborate on how changing our healthcare delivery system will have a positive impact on the small business health insurance market?
Madam Chairwoman, I welcome the opportunity to answer that question because it may seem disconnected, but basically we tend to focus a lot as the distinguished members who actually run businesses or talk to people who do on a daily basis, like my brothers, I would say, but they tell us they focus on insurance costs because that's the price they pay. But as the gentleman from Cincinnati mentioned, it's the health care costs of the people we're covering that actually drive everything. And what we know, Madam Chairwoman, is that health care costs have been growing so much faster than economy-wide productivity. More and more Americans are finding it unaffordable. More and more small businesses are having a hard time. We just learned about that record. So the core issue is how do we reduce the rate of cost growth, and I would even say it's really about how do we get more value for dollar as opposed to cost per se. So what I want to do is both encourage you to work with everybody to make the insurance market better, but the insurance market just reflects what the healthcare cost structure is underneath. So we've got to dig underneath and do that. Your emphasis on wellness is a great place to start, but we basically have to buy smarter. Right, we have tolerated far too much imprecision, not knowing, assuming all hospitals and doctors are the same, assuming they all know everything they need to know. You know, I had a dean of a medical school tell me a couple years ago, when he started practice 30 years ago, he had to understand 8 drugs, because that's really all you needed to do to practice medicine in the United States then. There were 200 new ones last year. No one can manage that much information. We need to provide information tools, better incentives, and get way smarter about buying.
Mr. Haynes, a growing number of small firms are using consumer-driven, high-deductible health plans as a means of containing premium costs. Are high-deductible plans addressing the problems being faced by your members, or is more needed?
I think it is a difficult and possibly not that effective solution. And I say that believing in theory that if you create the right kinds of incentives for consumers, markets will work better. The practical real-world experience that we have is that it is very difficult for consumers of healthcare services to understand all the choices that are available to them, to process all the information they need to process in order to make the right decisions on how much money should go into a pool and how to manage their own health care. I think they need help.
Okay.
That's my opinion, and therefore I think that I can't debate the academic merits of the issue of employer-provided versus individual insurance, but I do believe that individuals need help from a trusted source in managing their health care in a way that they are comfortable with and that will deliver the best results.
Dr. Nichols, let me ask you, do you find that these plans tend to shift the responsibility of who is paying for health care coverage?
They have, but I would also say the record is mixed. I would say it this way. There was sort of like what you might call consumer-driven 101, which was in some ways more an attempt to just shift the responsibility and the risk. But increasingly there is some consumer-driven 201, and let me hasten to agree with my colleague, Mr. Haynes. People need agents. They need help. But it turns out if insurers or employers do provide that extra information, people can make better choices. What Stuart and I are thinking about in terms of having a marketplace that brings those kind of advantages to all would still hinge on individual choice, but informed choice, the choice that actually uses the information tools we have. We're going to always trust our docs, but our docs need help. We need to trust our employers. We do in small employers' cases. Large employers, I'm not so sure, but in small employers we do. But they need help too, because this purchasing health care efficiently is a complicated thing. WebMD is wonderful. It can't always help you decide. You need an agent you trust.
Thank you. Dr. Butler, critics of individual tax credits to increase coverage argue that it has the potential of eroding employer-based coverage. Is it possible to avoid this outcome while still offering tax credits or incentives to individuals?
Yes, I think it is, and I think I would agree with both my friends Linda and Len on the importance of structuring the market and the insurance market in parallel to providing individual tax credits. I would certainly agree that if you merely gave somebody a tax credit and let them sort of go off on their own, then indeed you would get massive adverse selection, you'd get only certain people leaving an employer's plan and so on, and that would be destabilizing. So I do think it's very important to combine them. In fact, in my view, in terms of a health insurance exchange system, I do believe that the employer should actually make the basic decision about whether their employees actually have access to plans and to credits and so on through the health insurance exchange. So I recognize that, but I think there are steps, very prudent steps that can be taken to make sure you minimize any risk of unraveling of existing coverage. And I would point out, of course, that we're all basically saying that there has to be some means to make sure that people have both adequate resources to obtain coverage and an adequate array of reasonable and affordable plans. And I think it was Leonard that emphasized this, that I think that trying to focus that subsidy on the individual in that situation is better than trying to focus it on the individual's employer in that situation.